welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Computer model as guide for treatment selection in chronic myelogenous leukemia, study finds. Researchers in a new study used their computer model as a guide for treatment selection for patients with chronic myelogenous leukemia. The study highlights a new method that can help people with a specific type of blood cancer get the best medicine for them. Findings are present in PLOS computational biology. Today, the most effective form of treatment for chronic myelogenous leukemia is stem cell transplantation. Many can avoid transplantation if they receive effective help with medication instead. The vast majority of people can manage without it as long as they receive effective medications called thyrokinase inhibitors. But there are 5 different medications for chronic myelogenous leukemia, and it is important to find the one that is most effective. Meta-analysis shows combining electrical muscle stimulation with resistance training increases strength. In a new meta-analysis study published in the European Journal of Applied Physiology, researchers found that using neuromuscular electrical stimulation while doing resistance training leads to greater muscle mass and strength compared to resistance training alone. Researchers conducted the meta-analysis comprising more than a dozen studies that used neuromuscular electrical stimulation and reviewed their results. The analysis focused on studies where participants performed traditional resistance exercises such as bench presses or squats while using neuromuscular electrical stimulation devices. The study compared the results of participants using electrical stimulators while exercising to those who did the exercise with no electrical stimulation. Participants' muscle mass and strength were assessed at the beginning and the end of each study. Training periods for participants ranged from 2 to 16 weeks, with longer durations yielding better results. Global study highlights tobacco use dominates lung cancer deaths, but air pollution becomes increasing concern. A new study published in eClinical Medicine, part of the Lancet, analyzed tracheal, bronchial and lung cancer data from the open source Global Burden of Disease database. The results indicated an 8% overall decrease in tracheal, bronchial and lung cancer deaths over the 3-decade period. While tobacco-related deaths declined, they continue to represent the majority of cases. Meanwhile, mortality linked to particulate matter air pollution has risen globally and asbestos exposure remains a critical concern. The study found that the percentage of tracheal, bronchial and lung cancer deaths linked to tobacco use declined from 72% in 1990 to 66% in 2019. Although certain countries such as China and Indonesia are still experiencing rising tobacco-related cancer mortality. Moreover, the global mortality rate among women increased by 2%, though men still account for about 3/4 of tobacco-linked deaths. Link between menopause and faster progression of multiple sclerosis in women, UCSF study finds. A new study by the UC San Francisco has found that menopause revs up the progression of multiple sclerosis. Following menopause, patients' walking slowed down, and there were subtler changes in fine motor skills and cognitive ability. Women account for 75% of multiple sclerosis patients, and hormones play a significant role in the course of the disease. The study followed 184 women before and after menopause. It was based on the data from 2 UCSF studies, EPIC and Origins, that seek to discover the causes of multiple sclerosis and the way it develops. Participants were evaluated each year for an average of 13 years. Other research has reached contradictory conclusions about the role of menopause in multiple sclerosis progression. Some studies use a tool called the Expanded Disability Status Scale that primarily focused on walking assessment. In the current study, researchers use the Multiple Sclerosis Functional Composite, which captures walking speed as well as other tasks. They found that following menopause, it took participants longer to complete a 25-foot walk after accounting for age, weight and tobacco use. They also found subtler declines in dexterity and cognition. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.